Hello again to all of you in the room, those tuning in via our live stream, and watching on YouTube. This is an extra special introduction for me. Not only is our next speaker a fellow Iowan, but it's also through Dr. Terry Wahls that I was first learning about functional medicine. Dr. Wahls is a functional medicine certified professional medical and a clinical researcher at the University of Iowa, where she applies functional medicine principles to multiple sclerosis. She's published over 100 peer-reviewed scientific publications, abstracts, and posters related to multiple sclerosis, autoimmunity, and chronic disease. In 2018, she was awarded the Linus and Eva Helen Pauling Award for her contributions to research, clinical care, and patient advocacy, and she's the author of several books on using diet and functional medicine to treat autoimmunity. Diagnosed with secondary progressive multiple sclerosis, she was confined to a tilt-recline wheelchair for 4 years. But by designing a targeted diet and lifestyle program specifically for her brain health, she restored her wellness and today pedals her bike to work. It's incredible. I'm so excited to welcome to the stage Dr. Terry Wahls.
Thank you. Okay. The neuroplasticity revolution. There's my disclosures. We have 90 million with a neurodevelopmental disorder affecting adults and children. Learning disabilities, 65 million adults, 3.9 million children. Attention deficit hyperactivity disorder, 15 million adults, 3 million children, or pardon me, 5 million children. Intellectual disabilities, 3 million adults and 5 million children. And then we have 33 million with a neurological or neurological injury disorder. Diabetic neuropathy, 18.3 million. Alzheimer's, 6.7 million. Traumatic brain injury, 5.3 million. 2.5 million new TBIs each year. I practice martial arts, full contact, free sparring. In Taekwondo, we get 2 points for kicking people in the head. So I've given plenty of concussions. I've had a few myself. I feel bad about that now. Schizophrenia, 2.4 million. And I have an aunt with schizophrenia. Multiple sclerosis, 1 million. Parkinson's, 1 million. And strokes, 795,000 a year. 610 new strokes every year. Many of those will succumb to that. And spinal cord injury, 305,000, with 18,000 new spinal cord injuries every year. Now, all of these, there's no curative treatment for any of those. But you may have FDA-approved treatments that are available. You may have some rehab centers that you send people to. But neurological injury, in neurological disease, how can we restore function to these people? Again, neurological disease, in neurological injury, think of the spinal cord injuries that happen every year. Now, neuroplasticity is the ability of the nervous system in the brain, the spinal cord, to reorganize itself in response to the environment, the stimuli that we have, and the experiences that we have. You realize that you are reorganizing your nervous system today, this weekend, by hanging out with all of us and being exposed to these new ideas and new concepts. And this can have either positive or negative consequences for our function, depending on what we choose. So, how do we use neuroplasticity to improve the function of our patients? I'm going to give you a little glimpse of our evolutionary history. It was 4 billion years ago that the first biochemical processes began. And then About 1 billion years ago, we invented sex. What a wonderful thing. It allowed us to have a more rapid evolution of the morphology of life. We have plants, we have fungi, we have animals. And then, about 200 million years ago, mammals emerge. And 7 million years ago, APOE4 emerges, our brains develop a bit more rapidly. At 6 million years ago, we separate from other primates. And at 2.5 million, we have the genus Homo. And in a really very brief amount of time, we have our ancestors, Homo sapiens. Now, our bodies and our physiology has been shaped by these 4 billion years. And our bodies have been shaped by evolution. And our nervous system has been shaped by evolution. Our ancestors had to walk. The men, you guys were walking 10 miles a day to get food and then carry it all back. The women, our mothers, were walking 2 to 3 miles a day, gathering and carrying the kids back. So we're all physically very active. We ate tough, chewy food. We had plenty of room for our teeth. We didn't have crooked teeth. We didn't have to have our molars extracted. Our skeletons, our bones, our muscles are shaped by work. And our nervous system is also shaped by work. Any part of your brain or nervous system that is not being used is going to be reallocated to other parts of your body. It will get diverted. So we all know if you go to bed rest, we lose bones, we lose minerals. It is bad for us. This is a schematic of our nervous system. We have astrocytes that bring the nourishment from the capillaries to the neurons and the microglia. The microglia are inspecting the environment. The oligodendrocytes build the myelin. The microglia and the M4 are the surveillance. They are monitoring the environment for threats or damage. And if there are threats or damage, they will activate to M1, call in other immune cells that will dissolve the damage, eat it up, or attack the threat. And then once things have been fully resolved, they will call in a different set of immune cells that reduce the inflammation, call in the stem cells, and begin the repair process, rebuilding the myelin, rebuilding the synapses. And whether we have more activation of the M1 or the M2 phenotype depends largely on the microenvironment, which depends on the modifiable lifestyle factors. So can we help our patients get a better match of their environment to the environments in which our DNA evolved? Social isolation. We have an epidemic of loneliness in adults, in our geriatric population, and now in our children. And if you have loneliness, without clarity on the meaning of your life, you're going to have increased activation of the innate immune system. You'll have more emotional dysregulation, decreased social skills, more rage, more violence, more depression, anxiety, brain fog. It will affect the brain architecture, and you'll have a smaller brain. And much higher risk of Alzheimer's, dementia, anxiety, depression, and a higher risk all-cause mortality. But if we can replace loneliness with social connection, it turns out that is more protective than having a better nutrition, more physical activity, and even never smoking. Think about that. Better social connection and meaning trumps all the other modifiable lifestyle factors. So how do we help our patients get connected? How do we help them find meaning in their present circumstance? What about sleep? If you have good sleep at night, it reduces that reactivity of the microglia. It helps us clear the tau proteins. And if there's sleep disturbance in your patients, that precedes the diagnosis of Parkinson's, Alzheimer's, and multiple sclerosis by 5 to 10 years. Again, we should be asking our patients about their sleep. We should be asking, do they snore? We should be asking, did they wear braces as children? Do they have crooked teeth now? Did they have to have their molars removed? Check for obstructive sleep apnea. If they have it, refer for treatment. It could be dental sleep medicine. It could be speech therapy. It could be taping their mouth. And it can be CPAP. Key is screen for it, treat it if detected. And think about melatonin. Our melatonin production declines after adolescence steadily. It declines sharply after age 40. You have almost none after age 50, which is why old folks, we don't sleep very much. Giving people melatonin support and supporting their other hormones, very helpful. Melatonin has antioxidant, anti-inflammatory effects. It helps support the microglia, shifting them from M1 to M2. And it improves sleep. It reduces sundowning. So get people outside for early morning light. They can just sit on their porch, sit on their deck, go for a stroll. Add melatonin. The light will help improve their circadian rhythm. Exercise. Again, exercise helps shift you from M1 to M2. Our ancestors, we had to work really hard to get our food. And again, it will influence growing, calming the microglia, making the oligodendrocytes that will repair myelin, repair the synapses, and it will help improve nerve growth factors. This together will induce myelin repair and synapse formation, boosting the nerve growth factors. And it also improves glucose metabolism, lipid metabolism. And we know that high glucose insulin resistance accelerates brain atrophy. It also reduces constipation. Exercise is more effective treatment for anxiety and depression than SSRIs. So encourage physical activity, encourage exercise, encourage lifestyle activity, encourage the use of a wearable device, whichever wearable device that is convenient, so people can track their minutes of low-intensity activity, moderate-intensity activity, high-intensity activity, and minutes of sedentary activity. And sedentary activity is more destructive than 15 cigarettes a day. Send your patients to physical therapy in rehab centers, or occupational therapy in rehab centers, or to a personal trainer, or to a gym. So after an acute injury, an orthopedic injury, there is remodeling of your spinal cord to decrease the messages to protect your thigh muscles so they aren't putting your knee or hip at risk. This is also true for chronic injuries, multiple sclerosis, a stroke patient, and we have remodeling of the spinal cord, of the pathways, before there is atrophy of the leg muscles. There is atrophy in the spinal cord. And that's from the disuse injury. You get this inhibition of muscle activation, then the muscles atrophy. All this leads to an increase of less efficient, less effective methods of movement, whether it's for your hands, because your hands are affected, or you're walking because your legs are affected. This will make rehab and function more difficult. So you got to help fix this. So I want you to send people to physical therapy or occupational therapy for a technique called neuromuscular re-education. We are wakening up that messaging from the brain, the spinal cord, out the motor nerves, and it's really quite powerful. That needs to happen before you can begin to increase the muscle size. It's very slow, precise, targeted movements, and that really helps restore that connection. So you can do this by sending them to neurology PT, multiple sclerosis PT, geriatric PT. The orthopedic PT is not as familiar with the neurologic patient. If that's all you have in your community, that's fine, use them. But if you have neurology, multiple sclerosis, or geriatric PT, that would be better. How many of us are glued to our phones? Okay, raise your hand. How many hours are you spending a day on your phone? Too many, too many. And are your children on their phones? The adolescents are, certainly. What about the young children? Now, adults, we know that if we're on our phone, it's shortening our attention span. It's decreasing our working memory. It is decreasing our critical thinking, our ability to evaluate what is true, what is propaganda. We have reduced numeracy. We are not as good with our calculations. We can't do our math as well, can't do our subtractions or additions or multiplications. We have difficulty with literacy, with writing. So many of us are using agentic AI to write our articles, to write our blog posts. It is reducing our skill with language. It increases our vulnerability to addictive behaviors. It increases or decreases our social skills. It makes us less, we have less empathy. We are more irritable, more angry. We have a shorter fuse. And then for our children, these are grave threats. The very young children who are exposed to screens, they are delaying their developmental milestones. Our pediatricians are changing the developmental milestones. That should frighten us all. We're delaying language acquisition. We're delaying motor skills. We're delaying walking, crawling. This is tied to the digital device use. Okay, remember I think it was 18 million with diabetic neuropathy, a leading cause of painful pain that's keeping people awake at night, disrupting their sleep. Now, transcutaneous electrical nerve stimulation, or TENS, these are a couple of meta-analyses done for diabetic foot neuropathy. 2 meta-analyses with about 2,000 patients. And they were comparing this to other modalities. Some it was control, some they were comparing towards other pharmacologic modalities. TENS was always consistently superior for pain relief and better sleep. So if you've got somebody with diabetic neuropathy, use TENS. It helps to close the pain gate signal in the spinal cord. Send them to a physical therapist who can help them get a device, show them how to use the device, what settings to use. It's very, very effective for managing their pain. Okay, spinal cord injury. I think there was about 18,000 new cases every year. You can be paraplegic or quadriplegic. And Christopher Reeves, when he became paralyzed, he spent a lot of his fortune into developing some of the treatments for the spinal cord injury folks. You see, the muscles are endocrine organs. We all know that if you are not moving, you have worse glucose metabolism, worse lipid metabolism. You then develop insulin resistance, obesity, diabetes, and heart disease. And there's more constipation, more anxiety, more depression for these folks. And they would die early from the complications of obesity, diabetes, and heart disease. Christopher Reeves, we have to thank him in the money that he sent into functional electrical stimulation for people who are paralyzed. Now there are studies using functional electrical stimulation for people who are seriously disabled, that are walker dependent, wheelchair dependent. Some folks who are cane dependent are using this as well. And so if you look at her, she has electrodes on her legs hooked up to the device. Her feet are strapped into the pedals. And there's be electrical-driven contractions of her legs to cycle the pedals. And she's paralyzed. She's not going to walk again. This is not going to help her walk again. But what it does do, it will reduce the harm of inactivity for the person who's paralyzed, who will never walk again. And it will reduce the harm of disability for the person who's a walker and wheelchair dependent. If the person who's walker or wheelchair dependent also volitionally contracts their muscles while they're cycling, it can improve the connection between the brain, the spinal cord, and the muscles, and it will improve the power that they can generate. So it will improve strength and function of their legs. It will reduce their constipation. It's going to improve their mood, and it reduces the risk of falls. Again, you can get this off label, so this is an out-of-pocket expense for getting this device. Okay, and there are adaptations of functional electrical stimulation for foot drop and hand weakness. And for a foot drop, it's an electrical orthotic for the foot drop that brings the forefoot up at the ankle. It improves people with abnormal gait, reduces the risk of stumbling. And there are leg sleeves that you put on for the whole leg that you wear as you walk, and the device is programmed in a very sophisticated way to improve the function of the thigh, the hamstrings, and the tibia anterioris. And as a result, it improves walking, reduces fall risk. And there are gloves that can be worn to improve hand function. Now, the gloves are earlier in development than the leg sleeves. Athletes have been using neuromuscular electrical stimulation, putting electrodes on the legs, the belly, the butt, the back. And the athletes have been using this for decades. It was the Russians that developed this technology at first. And it builds muscle mass for sprint and strength sports. It's a great way to build muscle mass that does not require testosterone. So again, the athletes and the bodybuilders have been using this for decades. Recently, we have been using this for people with chronic disease, neurologic disease, people in the ICU, people with osteoarthritis, rheumatoid arthritis. And now the athletes use this to speed recovery from injury or to build muscle mass. Again, now if you want to send your patients to this, you can go look for an athletic PT practice because they're the one who use this device and have the most experience. Because you need somebody who knows how to, get the device and what electrodes and what settings to use. But you want to be sure that they're pairing it with task-specific exercises that will address the specific areas of weakness that people have. And that will lead to improved motor function. You're waking up the connection between the brain, the spinal cord, and the muscle, and you're building muscle strength if people are adding in the task-specific exercises. You will also get a tremendous boost in nerve growth factors, BDNF and others. Now, there are two sets of devices, alternating current and direct current. Alternating current is like the wiring in your household. It cycles positive to negative. Direct current goes in one direction. There's been relatively recent changes in technology that reduce the pain that you have with direct current. It's more physiologic. I still do it, even though I can now jog on my treadmill. I like to do about an hour of direct current every day because, man, I just love what it does to my mood and to my mental clarity. Okay. I think I already said this, so we're going to go past that. Nutrition. Now, we know that there are specific micro and macronutrients that our brain and nervous system needs to work well. I'll run through. And we also know that the standard American diet with 320 to 350 calories of carbohydrates, or grams of carbohydrates, is going to be insufficient in these key nutrients. We need essential fatty acids, omega-3, omega-6. We need B vitamins, vitamin C, vitamin E, vitamin K, and vitamin D. Of course, we know that we get vitamin D mostly from the sun or supplements. And we need minerals, magnesium, calcium, zinc, selenium, iodine, manganese, and chromium. Phosphatidylserine, but we also need all the phospholipids. So we need phosphatidylcholine, phosphatidylserine, tryptophan, carotenoids, and we need lutein, zeaxanthin, mesozeaxanthin, which are particularly important for the retina, but also for our brain parenchyma as well. But our ultra-processed foods, the added sugar and the white flours, which are made to extend shelf life, stripped the food of vitamins, minerals, essential fats. It's low in the polyphenols. It's high in sugar and white flour, emulsifiers, stabilizers, flavor enhancers to make us addicted to these foods. And our children, 68% of the calories are from sugar and white flour. And adults, our adult patients are not much better, 59% of our calories. And the sugar addiction occurs via the same process as cocaine addiction. The nucleus accumbens, the reward center, is heavily stimulated by sugar. And if our children are given sugar and ultra-processed foods in the first 2 years, there are dramatically increased risk for brain problems, for metabolic health problems, for diabetes, insulin resistance, fatty liver disease. And food dyes to make the food so colorful and appealing to our children and to us. Change gene expression and brain development in our children. And it's linked to higher rates of ADHD, which we have an epidemic in our kids. And artificial sweeteners changes the circadian rhythm, it changes the microbiome, it changes our neurotransmitters. We have more dysbiosis and glucose intolerance marching us towards diabetes. The artificial sweeteners do not lower the risk of diabetes. Increase the risk for headache, depression, and memory loss, and a higher risk for stroke. Now, the Mediterranean diet elements, I'll review them for you. More vegetables, more legumes, beans and lentils, and more fish, ideally 2 to 3 times a week. And reduces sugar and white flour products. It's not the overflowing plates of pasta. There's less red meat. Now, if you look at the dietary studies, the studies with the dietary pattern with the most research behind it is the Mediterranean diet. And if you look at meta-analyses combining studies of multiple Mediterranean diet studies, that Mediterranean diet pattern is very protective. It reduces the risk of Alzheimer's, of Parkinson's, of cognitive decline, all cause, stroke, depression. Okay, so here's some of our research. We looked at a low saturated fat diet, modified paleo diet. We had a usual diet period, so you came in, got assessments, followed your usual diet for 12 weeks, then we randomized you to the low fat diet, swank diet, or the modified paleo elimination diet, the Wahls diet. You came back in 12 weeks, got reassessed, and you had 5 calls with a dietitian. After that 12-week assessment, we no longer called you, and we brought you back in another 12 weeks. So we have 12 weeks observation, 24 weeks intervention. The red line is clinical significance. What you see is the modified fatigue impact scale significantly reduces compared to observation at 12 weeks. It reduces further at 24 weeks for the Wahls group. The quality of life improves at 12 weeks, improves further at 24 weeks. Now, for quality of life, Wahls is significantly more effective than Swank, but both diets were helpful. The 6-minute walk test, which is a measure of walking endurance, doesn't really change for 12 weeks. At 24 weeks, is remarkably improved, although statistically not different from Swank. Okay, diet and changes in measured disability. This is from the same study. We looked at MS functional composite. That's a measure combining the 9-hole pegboard, measure of hand function, 25-foot walk test, measure of walking, single-digit modalities test, measure of working memory. Compare the observation to the intervention periods. Swank improves from the observation to 12 weeks, further improvement at 24 weeks. Wahls doesn't improve at 12 weeks, but remarkably improves at 24 weeks. So changing the diet leads to improved measured function. Then we looked at a couple of randomized controlled style of the modified Paleolithic diet. And we show that in the paleo group, disability is reduced at 12 weeks. In the second study with more progressive MS patients, the paleo group is stable and the control group worsens over 12 weeks. So the earlier you intervene, the better people will do. If you intervene late, it will probably take longer. Now, this is a network meta-analysis that combines multiple studies. We had 12 studies, 608 patients, so still fairly small, comparing low-fat, Mediterranean, Paleolithic, anti-inflammatory, fasting, calorie restriction, ketogenic usual diet. And we'll update it in 2028. What you see is the horizontal line is the 95% confidence interval. The gray box is the mean and standard deviation. So paleo, low-fat, Mediterranean reduces fatigue. Paleo about 30% more than Mediterranean or low-fat. For quality of life, paleo and Mediterranean are helpful, with paleo about twice as effective. And for mental quality of life, again, it's paleo and Mediterranean, with paleo still twice as effective. But these are small studies. We need larger, longer studies. Ketogenic diet in severe psychiatric disease. I'm going to sort of go through this. I'm running out of time. So they have favorable case series, case reports, small pilot studies. And for severe anxiety and depression, for bipolar, schizophrenia, and schizoaffective, ketogenic diet is helpful. Now, a 4-month study, single arm, improved metabolic markers, abdominal fat, lipids, glucose, and we have better psychiatric scores here as well. Randomized studies are underway. So patients with severe psychiatric disease add insulin resistance, have insulin resistance and family support. Consider a low-carb ketogenic diet. It will be very helpful. And yes, we need randomized controlled trials for the mental health issues. We can't. Now, what if you combine in a multimodal fashion better nutrition, exercise, stress reduction, and I'll talk about me. I'm diagnosed with relapse remitting, age 45 at 2000. I converted to secondary progressive MS in 2003. I needed a tilt-recline wheelchair. By age 52, I cannot sit up anymore. I have a zero-gravity chair like this at work, another one at home. And I'm beginning to have brain fog. I have trigeminal neuralgia. The pain is more severe, more difficult to turn off. I discovered a study using electrical stimulation of muscles and people who are paralyzed. I convinced my physical therapist to give me a test session. Hurts like hell. But I feel great afterwards, and so we added to my PT. And then I discovered this organization called the Institute for Functional Medicine. I take this wonderful course. Catherine Woolner was a key part of that. And I have a longer list of supplements that I've added to the Paleolithic diet that I had adapted in 2002. And then I have this big aha. What if I redesign my paleo diet based on this long list of supplements? And I start this new way of eating December 26, 2007. And we wrote up the results in this lovely article because within the year, from being unable to sit up, I'm able to bike 18.5 miles. And of course, that changes everything. I begin changing how I think about what is possible, about how I practice in my traumatic brain injury clinic, where I had been sent to try and force me into retirement. I start talking to those vets that, yes, there's a lot we can do. We can fix your nutrition, put on a step counter, add in a Epsom salts bath daily. And my traumatic brain injury folks were still married. They still had their job. They were getting stronger. My primary care folks, I started talking to diet and lifestyle. They were reversing their diabetes. They were reversing their anxiety, their depression. They were far more functional with their PTSD. My chief of medicine said, let's do a safety and feasibility study. So we got this going. And so we compared the 9 cups of vegetables, 3 cups of greens, colors, sulfur. Or we encouraged liver once a week, fish, grass-fed meat if they could afford it. We taught them how to do a mantra-based meditation, mat exercises. We taught them how to do electrical stimulation of muscles, gave them a device and the supplies to use. And we had some targeted supplements as well. People were between cane and walker. If you're overweight, you lost weight without being hungry. One had to withdraw because of continued cognitive decline. Now, keep in mind, you expect a 15% worsening every year due to progressive MS. But half experienced improvement in walking function, and as a group, they were stable, which you would not expect at all. You see that we radically changed their diet. They stopped the gluten, dairy, and eggs, and they started eating more vegetables. And these severely disabled folks began to exercise, and they slowly increased the amount of exercises they were doing, and they increased the amount of electrical stimulation they were doing. And we did not make their lipids worse. In fact, their BMI went down, total cholesterol went down, triglycerides went down, HDL cholesterol went up, the triglyceride HDL ratio went down, and so they had better insulin sensitivity. And the top 2 lines are improvements in the general health, quality of life, short form 36, in the energy, which is a measure of really fatigue, so they had more energy, less fatigue. The bottom line is a reduction in fatigue severity scale score, so that significantly improved. This is a look at their baseline walking. 127 seconds to stand up, walk 8 feet, come back, and sit down. And fatigue severity scale score of 5.6. At a year, she's down to 41.8 seconds, fatigue score of 4.4. She can walk stairs for the first time in 6 years. Subject 11 takes her 14.9 seconds. In 3 months, she's down to 8.6. Her fatigue severity goes from 5.3 to 1.4. And that was at just 3 months. Subject 17, primary progressive, 21 seconds, needing 2 canes, goes down to 17.3 without a cane, and fatigue goes from 6.7 to 4.9. Then we have a quasi-experimental, non-inferiority study, and so people can choose which arm they're in. So you're newly diagnosed with relapsed-remitted MS, and DMTs were recommended. 29 came in, declined the DMTs, and we trialed them on the modified paleo diet, a walking program, and a breathing meditation. 15 took standard DMTs and got to eat and do what they wanted. And we measured fatigue, quality of life, mood, and cognition. And in the non-inferiority analyses, we show that declining DMTs and using a lifestyle program was not worse than standard DMT for fatigue, mood, quality of life, and cognition. Then we have an online course, again, a commercially available wellness course targeting autoimmunity that taught people about nutrition, stress, exercise, targeted supplements. We also talked about sleep and red light. 5 modules, lots of lessons within each module. You got access to the course immediately, or you waited 12 weeks. We got 100 people in. Again, waitlist control, immediate access, or you wait 12 weeks. And we had a conflict of interest management plan in place. We compared the intervention to the control group. We had significant improvement in quality of life and significant reduction in fatigue. And so access to the AIM course reduces fatigue. And now let's talk about cognitive decline, another disease that really doesn't have very good treatment. This is from Dale Bredesen. He has a couple of case series. The first one is 9 of 10 patients that he's using a functional medicine-based program. In 2016, he's got 10 of 10 patients that are improving well. And again, we've got some of the data there. Then we have a 2018 study where he has 100 patients and 72 out of 100 improve. And then we have a precision medicine guided intervention with 9 months of a personalized precision medicine protocol, really based on functional medicine principles. A mildly ketogenic diet, and then we investigate and personalize a supplement program and a lifestyle program, focusing on stress reduction, exercise, social connection, and targeted supplements based on testing. And we see improvements in the Montreal Cognitive Assessment Core, CNS vital signs, neurocog, Alzheimer's questionnaires, brain volume as measured by MRI, blood biomarkers, talking about highly sensitive CRP, hemoglobin A1C, the triglyceride HDL ratio, that's insulin sensitivity, homocysteine, vitamin D, but of course they're giving vitamin D supplements, so they really ought to. Those are the key points. We have opportunities for a few questions. And do we have the opportunity, modalities to ask questions? Michelle, is that possible? There's no Q&A. You mean I saved time for nothing? I didn't know that? Okay, well then I have one more important announcement. For anyone who lives in Iowa, there is a primary on Tuesday that I care a lot about, and everyone in Iowa should care. Go vote in your primaries.
Wasn't that just so inspiring? Thank you, Dr. Wahls.